So clinical examples are the patient says that there is nothing wrong and may disown the paralyzed limb and refuse to accept the responsibility for them. The patient may claim that the limb has a mind of its own or that it was left at home. Next. So the pathogenesis is not exact. Siddhi, the next slide. Hello. Siddhi.
I have done it, Sheetal.
Yeah, yeah.
There's some network issue, I think.
Yeah, okay. So the pathogenesis is not exactly known, but it is proposed that the lesion is in supramarginal gyrus. This is a part of somatosensory association cortex. This part interprets tactile sensory data and is involved in perception of space and limbs location. Further, Siddhi will explain. Thank you.
Is it in the
So the
non-dominant?
causes of anosmia.
Lesion is dominant or non-dominant side?
Ma'am, it is usually on the right side.
So that is considered to be non-dominant side, right?
Yeah.
Right side of the brain.
Yes,
In
ma'am.
those people who are left-sided. So that is considered to be non-dominant side. So lesion
Non-dominant
is
side,
usually
yes.
non-dominant side.
Yes, ma'am.
So the causes of anosmia are traumatic head injury, dementia, and stroke. So the testing is done by talking to the patient. The patient is asked what happened to the arm or the leg, whether he or she is paralyzed, and how does the limb feel and why it cannot be moved. Then the patient's response that we get is that they may deny the paralysis, saying that it is of no concern, and they may give some reason why the limb does not move as it should ideally move. Then treatment. The treatment suggestions usually given are often resolved spontaneously in the first 3 months after the stroke. It is noted that until the condition is resolved, the rehabilitation of the patient is hampered severely. Therefore, if the condition persists long term, it is extremely difficult to compensate for it. And safety becomes an important aspect while a treat while treatment and as for planning for discharge, because the patient does not acknowledge that he is disabled and will therefore refuse to be careful. Yes, ma'am, that's all.
Okay. One of the things she said, you can talk to the patient, but sometimes you can, only on observation, you can make out. Because if you see the patient, usually if you see the stroke patient, what do? They do not try to put more weight on the right side, meaning whatever side has been affected. Whereas these patients, they'll start walking the way they do it normally. They will not even think while getting up, while sitting, while walking, while standing, and they might land up with the falls. So this is one of the best way to identify if they have anosognosia, because usually the patient will just ignore it, as she said before, that there is some paralysis or something, and just start walking like a normal person. Okay? Thanks.
Yes, ma'am. Thank you, ma'am.
Purva and Mansi. Yes, just give me a minute to present the slide. Hello, Mansi.
Yes. Yeah,
Yeah,
it's
start.
visible. So, ma'am, somatoagnosia, it is a type of perceptual disorder in which there is a lack of awareness of the body's structure with the relationship to others. So, the next. So, it is also referred to as body agnosia, and the patient may complain of the arms or legs which are affected are very heavy, and it may also be seen with proprioceptive defects.